Morning, my name is Ryan Vasquez. I'm here to talk to you about health insurance. And since most of you in this room probably have heard the new Affordable Care Act, I'm going to give you a little more insight on it. Before I do, just so you can get an idea of how serious it is, I know a friend of mine named Gary. Gary was a good guy. He was probably in his mid-30s. He didn't make a lot of money, but he could afford health care before the Affordable Care Act came into effect. The problem that Gary had, though, was he procrastinated on everything. I mean, car insurance, paying his bills on time. And he actually had mentioned to me, I'm going to get health insurance today. I'm like, yeah, right, that's not going to happen. He said, no, I'll do it. Well, he didn't end up getting it like I thought he would, because what ended up happening was he got into a car accident. And he had car insurance, but no health insurance. So he had to pay a huge amount of money that the hospitals put on him. Now, the importance of that little story was to give you some insight that now the Affordable Care Act is now law. If you don't get an affordable plan by next year of 2014, the penalty for that, let's say you have a family of 4, 2 adults and 2 children. Those 2 adults per adult will be $95 each. Now for your kids, it'll be $47.50. If you don't think that's bad, you think, no, that's just chump change. Combined together, that could be a total of $258. That doesn't mean anything, right? That's chump change. Well, that's not the case, because as years go by, it will go up. And yes, there is also that if for each family member, how they're charged. There's also another option, depending on the penalty, how much you make in your family, they will charge you 1%. Now, in the Affordable Care Act, since the Affordable Care Act is just an affordable way for you to get health insurance, there are 4 plans I'm going to teach you about: the Bronze Plan, Silver Plan, Gold Plan, and the Platinum Plan. But before I go into that, I'm going to tell you about the Platinum Plan a little bit. That Platinum Plan does cover 90%, that's what your insurance will cover, and you only have to pay a small amount of out-of-pocket expenses. That plan is not reachable here in California. There's no one here that's that rich that could pay that Platinum Plan. It's out of reach. So I will just be going on 3 plans: Bronze, Silver, and Gold. Those are the 3 affordable plans that people in California can afford. And just to go back on the Affordable Care Act and put aside the plans, I'm going to talk about what the dates are when the enrollment starts and when it ends. The enrollment already started on the 1st of October. Now, it ends on March 31st of 2014. Now, putting that aside, let's go over I'm going to teach you about the Bronze Plan. If you decide to go with the Bronze Plan, if you want to choose a plan that's suitable for you, but you just want to have health insurance so you don't get penalized, you could choose the Bronze Plan. The insurance companies, if you choose a Bronze Plan, will cover about 60% of your medical costs. Having that said, that means you have to pay 40% of out-of-pocket expenses, deductibles, co-payments. Let's say, for example, just to give you an idea, let's say here in California, your insurance provider is Anthem Blue Cross, and you choose the Bronze Plan. Your deductible would be about $5,000. Now, according to Karen Delco, if you do choose a Bronze Plan, it's the lowest plan, and it has the highest premiums due to the fact you're paying about 40% compared to Silver, Gold, and Platinum. Now, since the Bronze Plan only covers about 60%, it is still the lowest plan. If you don't really need health insurance but still need to be covered so you don't get penalized, then choose the Bronze Plan. It's a lot more affordable. But if you're looking for a more plan that covers a lot more, like for Silver, if you choose a Silver Plan, you will be covered about 70%. Means you only have to pay 30% out-of-pocket expenses. Well, that's great. You want to choose something that's a little more, covers a little more. Now, according to Kevin Coleman, just to give you an idea of what health insurance provider you choose under the Silver plan, let's say most people here in California have Kaiser. If you choose Kaiser and you have the Silver plan, your deductible could be about $2,000. I say could is because it varies. Now, there is talk about subsidies and tax credit if you choose a Silver plan. That's really based upon what you have to pay for the Silver plan, because costs vary depending on which insurance provider offers that plan. It's merely based upon, if you do want to know more about a government subsidy, to see if the government can help you pay, that depends on your family income, where you live, and whether you smoke. Now, if you're looking for a more plan that covers way more than the Silver, which is which is a lot more, which would be about the Gold plan. The Gold plan is covers 80% by the insurance companies. Now, given the fact that it's a Gold plan, you don't have to pay a whole lot of out-of-pocket expenses. It's not a whole lot, and it would cover a whole lot. If you had a really serious medical condition, let's say you had a disease, or you only have one leg, for example. Well, you would choose the Gold plan. It would cover a lot more. You would have to afford painkillers. I'm pretty sure anyone would want painkillers. You must hurt. Now that I've gone over Gold, no one really knows. I know I had mentioned in the two plans earlier what it would be like if you chose those two plans, and what companies would it be like for your deductibles, your co-insurance, and your stuff like that. Since people are still enrolling on the Affordable Care Act and which plan they can afford, no one really knows which company would offer Gold, but it is said that Gold and Platinum, by Kevin Coleman, a journalist on healthpocket.com, he states that Gold and Platinum are the two plans that businesses have to offer. Well, that seems great. But Gold and Platinum are still a little high for most Californians. The only ones that could be affordable are Bronze and Silver. So Gold would be, you'd have to be almost really sickly. Now that I've gone over Gold, and I've already mentioned about Platinum, it's way out of reach. You'd have to be like Bill Gates to pay for that kind of plan. Since no one here is Bill Gates, I have gone over both. I have gone over the Affordable Care Act and its importance. I've taught you about the Bronze, Silver, and Gold, and I've mentioned about Platinum. As I said before, since Gary always procrastinated, you don't want to procrastinate on the Affordable Care Act. It's law now. Whether you like it or not, you still have to choose a plan, unless you want to pay the penalty, unless you can really afford it. Thank you.